This one vitamin doubled cancer response? What if something as simple as a vitamin could nearly double the effectiveness of cancer therapy? Not experimental, not exotic, a vitamin. Hello, I'm Dr. K. Paul Stoller, and some of you know I have a webinar on alternative cancer interventions, and this video is about one of them. In 2025, a randomized controlled trial published in Nutrition and Cancer asked a simple question: what happens if you correct vitamin D levels during chemotherapy for breast cancer? Postmenopausal women undergoing treatment were divided into two groups. One received standard care, the other received just 2,000 IU of vitamin D3 daily for 6 months. The results striking. 43% of the vitamin D group had a complete tumor response. That means no invasive cancer detected after surgery. The placebo group, just 24%, nearly half the response rate. Here's what makes this even more important.
Most of these women started out deficient. Vitamin D levels around 20 NGs per ml. After supplementation, they rose to about 28 NGs per ml. Still not high sick,
but enough to change outcomes.
In women who reached at least 20 NGs per ml were 3.6 times more likely to fully respond.
Now, I like to see levels around 80 in the patients I help. 28 is still very low and not normal. So what's happening biologically? Vitamin D appears to encourage cancer cells to die, slow tumor growth, activate tumor suppressor genes, increase sensitivity to chemotherapy, and even counteract depletion caused by chemo itself. In other words, it may be helping the body do what the treatment is trying to do. And the dose, just 2,000 IU per day, a level known to bring many people into a more optimal range. But optimal for a cancer patient is closer to 100 than 20.
Now, important context. This was a smaller single-center study. About 75 women completed treatment. So more research needs to be done, as they are always fond of saying. But understand, it has been known for years that women with adequate vitamin D levels don't get cervical cancer. This is a mic drop moment, but if a mic drops in an empty room, does anyone hear it?
But it is a strong signal, and one that raises a very practical question. If something this simple, this accessible, and this safe can potentially improve outcomes, why isn't correcting vitamin D levels standard in every oncology protocol? Ask yourself why it is no longer recommended to do routine vitamin D levels.
Sometimes progress in medicine isn't about discovering something new. It's about finally paying attention to what's already been in front of us. The CIA knew 70 years ago antiparasitic drugs could treat cancer. But in the good old USA, we don't interfere with corporations and their ability to make money, because there is no profit in the cure. We may just have to wait for the medical cartel to fade into history before we have inexpensive and efficacious cancer treatments that are embraced by physicians. To learn more, go to KENNETHSTOLLERMD.com. See you there.